human werewolf, fish odor, exploding head syndrome. No, I'm not going crazy. These are all names of weird medical conditions. And in this episode, I want to talk about them for you. So do not go anywhere and let's dive in. Hello my friend, welcome back to my show. This is Chatterdocs. I'm Dr. Tor and I'm an internal medicine physician who's got a lot of free time on his hand. So I'd like to talk about different medical stuff on my show, and I'd like to believe that learning about health and medicine does not have to be boring. So if you like my content, don't forget to subscribe to my channel and hit the like button. And if you dislike me, do not hit the dislike button. Just hit that little X up there and close YouTube. I want to talk about some other very interesting, weird medical conditions that not so many people know that they even exist. Number one, walking corpse syndrome. Have you seen the TV series Walking Dead? For patients with this condition, probably that's the favorite show. Walking corpse syndrome, also known as Cotard syndrome, is a neuropsychiatric condition in which a person would believe that they're dead, or they're missing a body part, or their soul, or their blood, or their existence. This condition has been explained as a part of certain psychiatric conditions like depression. I'd like to also call it Monday morning syndrome, when you feel dead inside at 8 a.m. walking at your workplace. However, neuroimaging have also demonstrated some neurological changes in these patients. This is an extremely rare condition, so not too much information is out there as far as the cause or the treatment. Fortunately, a lot of these cases, even the very severe ones, spontaneously recover on their own. Number two, jumping Frenchman of Maine. Jesus! This condition, which was first described in a group of French-Canadian lumberjacks who worked in northern Maine in 1870s, is also known as hyperekplexia. It's a hereditary condition in which the person has extreme startle reaction to the stimuli around them, and it can cause uncontrollable jumps and startle-induced falls. Most people experience this syndrome first right after birth or even before birth in the uterus, when it's called stiff baby syndrome. It can be effectively treated with a class of drugs called benzodiazepines, which include Ativan or lorazepam, diazepam, xazepam, or other zapams, which are usually used to treat acute anxiety and seizure disorder. Number three, Alice in Wonderland syndrome. I'm wondering where this syndrome is named after. We all have seen or read Alice's Adventures in Wonderland, where Alice experiences different transformation, like getting bigger or smaller or different other weird stuff that happens to her, and it's very interesting. In this neurological syndrome, also known as Todd's syndrome, the person would have migraines with a distorted perception of size, like they might think that things are way bigger or way too smaller than their actual size, or even they might think that distances are too far or too shorter than what they actually are, or having hallucinations, or feeling that time is going way fast or way slower than it actually is. This syndrome usually involves younger children and happens usually at the onset of sleep. It's not entirely a hallucination, it's actually a problem in your brain that affects your senses, and it can last from minutes to hours or even be chronic. As I said, it can usually be associated with migraine headaches, and unfortunately there's no treatment for that. Number four, geographic tongue. You might have seen people who have a map of the United States on their tongue, just like this. This oddly named condition involves psoriasis-like symptoms in the mouth, which involves harmless but often painful lesions on the tongue. They look like this or this, and as you can see, they resemble the shape of a map. Finally, doctors are coming to their senses, naming disorders and conditions. Believe me, dealing with all sort of nonsense, long-ass Latin names in medicine, this is a good one. Did you know what we call a blood pressure machine? It's called sphygmanometer. But why? Alright, back to our thing. As I said, these lesions can cause irritation or burning. The exact cause of this condition is not known, but conditions like stress, hormonal disorders, or rheumatologic disorders, or even eating spicy food can trigger geographic tongue. Oh no, are you telling me I cannot have spicy chicken tikka masala? This one's for you, Pratum. Number five, human werewolf syndrome, also known as congenital hypertrichosis languinose. Tell me about long-ass medical names. Is a condition caused by a genetic mutation that causes people to have excessive hair growth either all over the body or in certain areas. It can affect any gender or age. People with this condition will look like this. Oh no, not this. This is just a typical Iranian man. Like this or this. Treatment for that is removing the hair, but unfortunately it will grow back even if you laser remove the hair. So if you thought werewolves only exist in scary movies, Number 6. Fish odor syndrome. We all have had colleagues who stink like shit all the time, and we wonder why the hell don't they shower? Yes, David, I'm talking to you. Please, just shower. Well, fish odor syndrome is a real medical condition that's caused by an inherited enzyme deficiency that prevents the breakdown of trimethylamine, or TMA. This is a byproduct of protein breakdown, and if it's not dissolved, it will cause an offensive odor like decaying fish. As a result, this odor can be detected in urine, sweat, or even breath of these people. Unfortunately, there's no cure for this condition. Not even showering 10 times a day will take away the stinky stink. But symptoms may be reduced with a TMA-free diet that avoids peanuts, eggs, legumes, and certain fish and meat. Last but not the least, exploding head syndrome. Imagine you're trying to sleep at night and this happens. Yeah, this is real. This can happen. Although it's not painful, but it's very disruptive. Some people may experience it once in their life, but in severe cases, they may experience it up to 7-8 times a night. This is a literal nightmare. It's often triggered by insomnia and sleep disruption, which basically makes it a vicious cycle because it will disrupt the sleep even more. And also in certain types of anxiety. The biggest treatment for that is reassuring the patient and educating them that this is not a dangerous condition, and also treating their underlying anxiety if we can. If patients can have good sleep hygiene to regulate their sleep, it will help decrease these episodes a lot. If you're asking what is sleep hygiene and how to regulate your sleep, click up here to watch my episode on insomnia. Thank you so much for watching. If you liked this video, do not forget to tell YouTube that you liked it, and the YouTube will tell me. Or if you want to be much kinder, you can leave a comment and share this video with your friends. I would love that. Werewolf. Why, God, why? Don't forget to watch my other videos. And as always, do not forget, take it easy. We're all gonna die someday.